Experts call the maternal death rate in the U.S. unacceptably high, as that rate is larger than any other high-income nation in the world. And sadly, many of those deaths are preventable. Mandy Gaither has the maternal health risks everyone should know and explains why access to care remains a major problem.
It's considered one of the world's most powerful countries, but when it comes to maternal health, the U.S. remains weak. For every 100,000 live births in 2022, there were about 22 maternal deaths, with Black women being the most affected. That death rate is more than double, sometimes triple those seen in most other high-income countries that year.
It's an ongoing concern, and we're doing lots of things to try to bring those numbers down and get us into a better space.
Dr. Sarah Sams with the American Academy of Family Physicians says many of the maternal deaths are preventable, some linked to chronic diseases like obesity, hypertension, and diabetes. She says establishing care early on in a pregnancy is critical, but not everyone has easy access to that care.
Family physicians still provide maternity care in many areas, and especially in rural and underserved areas, kind of trying to alleviate some of those maternity deserts.
Sam says having a healthy diet, exercising, avoiding smoking, alcohol, and drugs play a big role in a healthy pregnancy. And since many maternal deaths happen up to a year after birth, she says postpartum care is also critical, especially if gestational diabetes or hypertension were present in pregnancy.
Many of these conditions are signs that you may be developing those as a long-term chronic problem.
Dr. Sam says another major concern after pregnancy is postpartum depression. That's another reason why she says it's so important for people to continue seeing their doctor after giving birth in order to be screened for mental health struggles. A new study is finding that people with attention deficit hyperactivity disorder, or ADHD, have shorter life expectancy and higher risk of mental health issues. The findings show that men with ADHD had a reduction in life expectancy by 4.5 years to 9 years, while women's life expectancy was shortened by 6.5 to 11 years. The analysis also revealed ADHD to be linked with a higher risk of mental health issues, such as anxiety, depression, self-harm, suicide, and personality disorders. Purdue Pharma and its Sackler family owners have reached a new $7.4 billion opioid settlement to resolve thousands of lawsuits. The lawsuit alleged OxyContin pain medication caused a nationwide opioid addiction crisis. The settlement calls for the Sacklers to pay $6.5 billion, with Purdue Pharma paying $900 million. Under the new deal, the Sackler family does not receive immunity from potential future opioid lawsuits.